ICT can make a difference in areas with very isolated areas of developing countries. So we try to research and find out solutions for this kind of scenarios. When we talk about remote areas, we mean, for example, the Amazon rainforest in Peru, where the communications are held only by boat, and you have to spend several hours from one health post to the health center where you can find a doctor. So you have to travel from a place where you have a health technician with a training a little bit lower than a nurse to a place where you have a doctor who can treat emergencies. No? Like as I have told, it can take a mean of 10 hours to travel from one point to the other. So in this kind of scenarios, having the opportunity to communicate to each other can make a difference, can avoid unnecessary troubles, and also can help to the technician to get support from the doctor. No? For example, we can use solutions, and this one is a commercial one that we have developed, free open hardware one, that is a telestethoscope that helps to the technician, as who takes the patient, hears the respiratory or cardiac sounds, and send it in real time to the doctor that is far away, maybe 400 kilometers away. The doctor can hear the sounds in real time, see the patient, see the technician, and help in the diagnosis, for example, of a respiratory disease, to make the difference between or differentiate between a flu or a pneumonia. The flu can be treated locally. The pneumonia normally the patient has to be transferred to a hospital. So that's why we think that communications are important in these kind of scenarios, and we try to develop new functionalities, new services like ultrasound services or telemicroscopy services to support the work of the public health system in these areas very isolated. For example, in Peru, we have developed a communication network as a pilot to prove these kind of solutions that communicates the health post of a river, the Napo River. It covers a distance of around 450 kilometers, and there you have like 13 health establishments. 9 of them are health posts where you find a health technician. 2 of them are health centers where you find a doctor, and then you only have 2 doctors in this big area, and you also can communicate with the hospital in the city, where you can find a specialist. So this network put in contact these 3 levels of the health system in Peru.